about the intermediate risk factors about postnatal assessment and management on the delivery suite for the thromboprophylaxis. Now that is, we're talking about this chart. Now this chart is very similar to the antenatal assessment for thromboprophylaxis. There are only very few differences that we have to know. Otherwise, both the charts of intermediate risk factors is similar. Now this is a familiar picture. The only difference is that there are a few more additions to the antenatal picture in this postnatal intermediate risk factor picture. Now what are the differences? If we can see, this man, he was not there in the antenatal portion because he is Julius Caesar, and we all know caesarean section, it has been named after Julius Caesar. Okay, so Julius Caesar with a labor, that is caesarean section in labor, is definitely a risk factor, intermediate risk factor for postnatal thromboprophylaxis. Now we see this lady who has a BMI of more than 40. Now we have to remember that a BMI of more than 30 will come in the next section, like it was for the antenatal assessment. It will come in the blue zone. But if it is more than 40, then it comes in the intermediate risk factor or the orange zone in the postnatal prophylaxis. So this fat lady standing in the hospital is BMI 40 and she's a risk factor for thromboprophylaxis in postpartum period. Now apart from almost everything is similar. This is the admission desk, the admission area. So any kind of readmission, or if we have a prolonged admission in puerperium, so admission is a important criteria. Readmission or prolonged admission in puerperium is an intermediate risk factor. Any surgical procedure, this was also there in antenatal factors. If you remember the picture, I'll show you. This was the antenatal picture. So surgery, any surgical procedure in the puerperium apart from epi repair. Epi repair is a small thing, so for that we don't score the patient, but apart from that, any other surgical procedure in the puerperium is again a risk factor, like we had for antenatal period, any surgery in the antenatal period. Okay, and after that we have the medical comorbidities that we talked about. So this is the same story we had talked about in the antenatal period, with a very few changes or correction, where the history part given by this man is removed and also OHSS is removed. Rest of things remain same, that is the intravenous drug abuse, and he's got swollen legs, so inflammatory polyarthropathy, he's an inflamed man, and then he sees the sickle, so she's got sickle cell disease, and now she's so sweet that he gets type 1 DM, and he has a nephew, so DM with nephropathy, nephrotic syndrome, and he has got a heartbreak the moment he sees this sweet sickle, so there is heart failure. So the same story runs again, and also this boy, he's watching a cancer. So this is about the medical disorders. So the picture for antenatal and postnatal assessment for thromboprophylaxis is very similar with a very few changes. If we can remember both the pictures, then we'll be able to remember this part of the table. Thank you.